Hey, gang, it's Wednesday, and you know what that means? It's hump day. It's Chad and JB. Jeff is not here tonight. We got a great show. We got a great guest, Dr. Jeffrey Harrison. We'll introduce him in a little bit. But in the meantime, do you have some news?
Always. Well, you were so kind to send me a news story this week. So I thought I'd start with that because it is a good feel-good story, and I would never want to end on a happy story. So we'll just start with that story. I always end with tragedy.
I'll drop down for your little YouTube segment.
All right. First off, I wanted to let everyone know, we've been watching the hurricane activity. The Floridas and the Carolinas all got hit pretty good last week with Hurricane Ian. So ADA has set up some support networks. They're working really closely with the Florida Dental Association as well as South Carolina, North Carolina to help support dentists and their team members. So if you happen to be watching tonight and you haven't reached out for those resources, certainly do that. Please post within our group as well and let us know if we can be of service. We'd be happy to do so. But if you are inclined to want to help out our fellow colleagues, reaching out to the ADA to get connected with different dental organizations that are deploying support throughout those areas, we can certainly get you connected pretty quickly. So just utilize the ADA for that. But again, our hearts are with everyone. And we were certainly watching it very closely. Hopefully that'll be it for 2022. One of the stories that Chad sent me this week was this really interesting story about a dental student who was commuting into the city in New York, I think, forgive my geography or lack of in that area. But he was on one of the highways there when a car kind of swerved past him, was driving a bit erratic. He decided to try to pass the traffic in the side lane. I think it was on the left side because ultimately he hit the guardrail and went into a fiery crash. He flew out of the car. And so the dental student stopped to provide aid, to call 911. The man who fell out of the car, was launched out of the car, was responsive, but a little bit incoherent. He went to the car. When he was on the phone with 911, they asked if there were any other passengers. He didn't see any at first, but when he looked closer, amongst kind of the smoke and fire, he saw there was a female in the car. So he helped pull her out of the car as well. They started walking down the highway. He said they got about 20 feet or so away and the car exploded and started going through different fire experiments. So kudos to that young man who helped save both a man and woman in a pretty bad car accident on the highway. He stayed calm, cool, and collected, and actually, by the grace of many, was able to all three walk away, I think, relatively unscathed. So that's amazing. Love to see our fellow colleagues out there putting their desire to want to help others in action, even outside of the operatory. If you are an ADA member and you want to express any comments related to the House of Delegates, which is coming up in October, you have until 5 p.m. on October 10th to submit your comments on any of the resolutions for the reference committee's review. So if you are non-House of Delegates member for this year, but you want to read the resolutions and provide comment, you certainly can as a member at large, but your deadline will be October 10th at 5 p.m. And as I mentioned last week, I personally am closely watching the amalgam resolution that's being brought forth to the ADA this year. This was something that the Dental Practice Council was also working on for the AGD last year. So we're attentive in watching that particular resolution to see what the delegates of the ADA feel about that particular topic. I was notified today of a very interesting website, and I wanted to share that with my fellow colleagues because maybe you already knew that it existed. I certainly didn't. And I have to give credit to one of our fellow dinks, Kim Robinson, who has worked in the dental industry for an incredibly long time and now works with the dental insurance company and has become a great resource for me in helping me understand better dental benefits sector. But she notified me today of a website called fairhealthconsumer.org. This is a website that you can go to, plug in a CDT code and get a marketable rate for that service in your community. So many of you ask, how do I know if my fees are competitive or not? You can always go to your dental supply companies. I know I've gone to Patterson before and asked for a fee schedule for my zip code. They will provide you that, but you can also go to fairhealthconsumer.org, plug in the code of interest to you, and find out what a reasonable rate might be in your particular area. In fairness, I did this with one code, became incredibly depressed, and left the website immediately because I'm obviously not charging enough. The last thing I wanted to let everybody know about was there were 3 cases this week that were settled with the Office of Civil Rights for HIPAA violations. And we don't talk about this a ton, but I think it's really important for everybody to understand. These 3 particular cases were settled because of a lack of responsiveness in medical records release. That means you have 30 days when a patient asks for their record, either in part or in full, you are obligated to give that to the patient. That is their personal property, and you have 30 days to provide that to them. If you don't, they have every right and all the grounds to go forward and file a complaint with the Office of Civil Rights Compliance. So please know that of all the things that we could get dinged for HIPAA violations, accidentally sharing information via an insecure email, our computers getting stolen, getting hacked, malware getting installed on our servers, all the things that are really difficult for us to control. The one thing that we can control is release of medical records in a timely fashion. And just so you know, these cases were settled between $25,000 and $80,000 for the settlement on those HIPAA violations. So that's easy money that we have to give away. So that's my PSA for today. You have 30 days to release those records to the patient, and they are patient records. And with that, that's the news.
That was absolutely fantastic. Hey, I know you talked about the dental student. Did you mention the dental student's name, or was it even mentioned in that article?
Let me pull it up really quick. I probably will not do a great job of saying it, but I will give it a try. Rubinoff was his last name. Asher Rubinoff.
What was the first name?
Asher Rubinoff.
Future Dr. Asher Rubinoff. Congratulations and kudos to you for being an outstanding Samaritan. That's just a really cool story. And
I thought so too. I really did.
Great stuff. Great stuff, as always.
Hey, really quick, I would be really negligent if I didn't also say, from a Dinks perspective, that we have almost 650 downloads of our podcast in the last 30 days. I mean, I think that's fantastic. We're really getting a lot of activity. I think that's becoming a great way to stay connected with the Dinks and to catch up if you don't have time to watch the live show, or you missed the part, or want to catch up on what we talked about. It's a great way to condense the information to a really portable format.
Awesome. Yeah, that's really awesome. And I will just say that this is just another notch on what JB does. She is really focusing on the podcast, and we truly, truly appreciate it. So without further ado, would you mind if I introduce our guest?
I would love it if you did.
So this is rather impersonal. I'm not really a fan of reading bios, but
I thought you were going to say a friend of Jeff. I was like,
no, I have not met Dr. Harrison, but I'm just going to say that I was the person that said, let's get Dr. Harrison on this week. So I just want to make that very clear. I followed him just because he has really cool cowboy hats, and he does sleep stuff. But anyhow, Dr. Jeff Harrison, he is the National Clinical Director of Sleep Group Solutions. And just this past week, he was appointed the Chief Implementation Officer, CIO of APZME, the first dental sleep medicine DSO in the United States. Dr. Harrison graduated from the University of Missouri, Kansas City. I always refer to that as UMKC. and completed a GPR at St. John's Mercy in his hometown of St. Louis. He is a laser dentist. He is a sleep dentist. He's a key opinion leader. He's an educator, professional speaker, consultant, clinician, founder of Colorado Laser Dentistry and Sleeping Giant Solutions, and retired from clinical practice in 2020 to step into his various roles at Sleep Group Solutions. So that's about all I'm going to say. I'm going to let Dr. Harrison introduce himself a little bit further. But Jeff, it's great to have you here. Thank you so much for being here.
Hey, I appreciate it. And I was, when I was back, I didn't have that, but like just for JB, I will take my hat off, because to do what you've done, a mother, a practice owner, a dink, like hats off. So there we go.
Oh, thank you. I appreciate it. I'm terrible at all of those things. So.
Like right now, I've got multiple jobs right now, and like you have multiple jobs right now too.
Well,
that's right.
Yeah, we're pretty impressed with her too. But Jeff, I've always been impressed with you. So tell us, when did you graduate from UMKC?
So the short story was I was a Doogie Howser. So I was one of those kids at 16 that got accepted to dental school. We skipped college, boom, 17 years old, I'm sitting in dental school. Did a combined 8 years in 6, going nights, weekends, summers. And the first 2 years, we were pretty much the same classes as medical students. So to me, the total health approach to dentistry, it always resonated. It made sense. Like, why isn't the mouth considered a part of the body? Like, it's removed, and we have our own special schools over here. And we know about as much medicine coming out of dental school as the medical students know about teeth. And so we've kind of always had this gap. And one of the biggest challenges, and I call it the final piece, is building that bridge that connects medicine to dentistry. Because as we get into airway management or sleep breathing, because honestly, we breathe 24/7. You know, sleep has been where dentistry has kind of gotten into this, but with all the orthotropic things that are coming to existence, we're starting to look a little bit earlier in life and root cause. And so my story is a bit backwards for how the traditional person falls into oral appliance therapy for jaw advancement or jaw repositioning, call it what you will, or oral appliance therapy just to be collective. And when I got out of residency, I took a job in St. Louis, which is where I was from. And it caused a lot of grief because like we were all set to go to Colorado. We just wanted to be in Colorado. And then here I go take a residency in St. Louis. I take a job in St. Louis, and it just kind of got things on the wrong track right out of the gate. But we end up in Colorado, and I'm working with a pediatric dentist that bought a family practice after being a missionary for like 30 years. And so he's like, I only want to see the kids, but I couldn't find a pediatric practice for sale, so I bought a family practice. Would you like to come out and see the adults? And I said, fine, I will, but I got to tell you one thing, I'm left-handed. And he's like, oh my gosh. He's like, I've been praying about this. I'm left-handed too. And so we connected. We worked together for about 2.5 years, and I came across a list of goals. And so I know a lot of your viewers are like younger practitioners or even students. One of the best things you can ever do is have written goals. And they need to change. Agree. And they need to, you know, when you achieve one, you celebrate for a moment, and then you write a new goal that replaces the one that you just achieved. And so at 5 years out of school, I came across goals I'd written on my first day of residency. And the only one I didn't achieve was own my own practice. And so we got into those negotiations here. We went and talked to the practice management consultant. And because he had been a missionary for so long, there just wasn't finances to secure his future. And so he basically pushes across the table all the plans to go launch a de novo practice, hang a shingle. And so in 1998, I hung the shingle and had 0 patients. Well, I had 2. I had myself and I had my wife. And then I had an office manager. So I guess we had 3 charts on day 1. But it was a booming age in Colorado Springs, which is where I practiced for the bulk of my career. The Northeast sector, kind of the nicer side of town where the officers lived across from the Air Force Academy. And we were getting 150, 200 patients a month. And I hooked up early on. Like I knew a mentor was going to be critical. So, I got associated with everybody that I could think of that could teach me something outside of school. So becoming a lifelong learner was important to me. And really, it was learning functional ortho first, which is the expansion. And, back in those days, it was all about uncrowding teeth. So like every patient you see that's got crowded teeth has an airway problem. It's like everybody you see. Some of them are worse than others, but you can absolutely help every one of these people. And they will have disguised illness that you do not associate with breathing, because a lot of us just think about the sleep component. But mouth breathing is like the killer of all things. And I was listening to a friend of mine speak, I don't even remember where I was, but he's like, the tongue causes 90% of all oral disease. I'm like, let me think about that. But it alters the oral microbiome, because if we're mouth breathing, you're going to have an aerobic environment versus an anaerobic. If you're not breathing through your nose, you don't produce as much nitric oxide naturally, so you tend to live in a chronically inflamed state. If you're doing that during sleep, it primarily leads to snoring, which can be the sign and symptom 80% of the time of a much severe problem, which is sleep disordered breathing. And until we have a diagnosis, we don't want to call it obstructive sleep apnea, but the bulk of the time it is. And that's where the dentist can shine, by either making an oral appliance to reposition the jaw, kind of like we learn in CPR, we tilt the head and lift the chin forward. Or if we back into the orthodontics of it, like what really caused this? Well, it was probably originally poor tongue posture, poor tongue function, a bad swallow pattern, mouth breathing. And so all those gummy smiles you see, those are mouth breathers when they were a kid, because their maxilla just grew downward looking for the mandible. That upper jaw is the criminal. It's too wide, it's not far forward enough. We've got to think in 3 dimensions, which is very capable now because we have cone beam technology. And so like when you get to, I'm like basically 30 years into practice. So I don't know, where are you guys at? How many years into practice?
15.
23.
Right, there we go.
Or 4. I don't know.
So the first 5 years are great because everyone else's work is crap and you get to replace it.
Yep.
At about year 10, you start to see your own work coming back and you're like, who did that? And they're like, oh, you did. And they're like, oh, I must have been off that day. Like at 30 years, if the light bulb doesn't go on, you're probably starting to get burned out. Like that dentistry to me can be a very mundane thing. You've got about 10 procedures that you do, and you do them thousands of times to where you could almost close your eyes and do the job. Sleep medicine, not so much. You get in there, and so we were talking about this a little bit right before the show. It's like you mentioned the word dabblers. When I was in Dallas last week, I was talking with a friend of mine, Dr. Smith, and I'm like, if I gave you the crystal ball, what's it going to look like in 5 years? He's like, the dabblers are going to be gone. You're either going to be doing dental sleep medicine or you're going to be a dentist. There's none of this kind of, I'll do it a day a week, I'll dabble in it here and there, I'll make a few devices a month. And so that's really why I've been put into this position. I am not afraid to admit I tried and failed at least 3 times to do dental sleep medicine in my practice. It's not easy. It's a challenge. There's a lot of moving parts and pieces to the puzzle. And so that is been what I have seen change the most at Sleep Group Solutions since I joined it. And this was probably been in the works for a very long time. I always like to take credit for it, but it was really probably something they had thought about. But the first complaint or objection I had is like, we're marketing a turnkey solution, a program that you can go take a course in a weekend and then go open it up. And while you can do that, that's certainly fine. I like to refer to dental sleep medicine as a journey. It's kind of like, we're going to give you everything, but you're going to get sucked into this if you love it. And like, you can't find enough courses because it is constantly changing. Every year it's something different. You bring insurance into it, it's totally different. And so what we've built in the last 2 years, so I started as the Western Regional Director. I oversaw 10 states in the Western US, but because of what I did before I joined Sleep Group, I had friends all over the country. And so I had my friends were like, well, you taught us laser, can you teach us airway? And so I said, sure. And so I had clients that were outside of my region, and then the regions kind of broke down. And it's just been, I lost the train of thought there. I hate when that happens. It's been a journey. That's where we were at. It's something different. I think every show I go to, it's something different. And there's a lot of people, I would say 9 out of 10 people do an oral appliance using a complete guess method. Well, it works half the time. And this is what we fight with medicine, is medicine looks at what they use, which is positive air pressure. And they're like, well, it works 100% of the time, basically, if you can get the patient to wear it.
Mm-hmm.
And then there's the Hokema study that shows, when you factor in compliance and effectiveness, they're basically the same.
Mm-hmm.
And the standards and guide. Yeah, go ahead.
Well, can you tell me what your tipping point was? You're a general dentist, going through the day-to-day routines on all that. Something must have tipped or happened in your mindset or in, an experience you had as a clinician that sort of tipped you into sleep. And I'm curious what that was.
So you're using the Simon Sinek. What's the why? Begin with why.
Yeah, sure.
Yeah. I'll tell you exactly when it happened. It was 2007. And so in 2007, the Scottsdale Center for Dentistry was opening. And I was part of that original 40 people that signed up with Gordon Christensen. We were learning from 20 of the top best educators that he could pick out of the population at that time. And about a year, maybe a year and a half into that program, it flipped into Spear education. Mm-hmm. And so Spear came in, and like I always say, one of the best courses I ever took was facially generated treatment planning.
Yep.
Yeah, great
all
course.
about the aesthetics. And airway wasn't discussed at that time. Rouse was not part of Spear at that time. And now it is. Like, you can't go to Penke, you can't go to Coish, you can't go to Dawson, even LVI. They're all putting airway as this umbrella over everything that they've taught in their mantra forever. So my brother is not a dentist, but he's like, what cult meeting did you go to, right?
Yeah.
So that was my tipping point. That was the Malcolm Gladwell tipping point, where in 2007, I had restored some mouths, and their dentistry lasted their lifetime. Because what do we do when we do a comprehensive case? We put everybody in night guards. Well, when you put a night guard, it's a flat plane splint, and someone that has severe OSA that had worn their teeth down in their mid-30s, you're not doing them any favors.
Mm-mm.
And so I had a couple of patients that didn't have a long life. The same year, my youngest daughter was struggling with pediatric sleep breathing issues. And that's when I said, something's got to give. So for 10 years after that, I went and learned about as much as I could. And then finally in 2017, I gave up restorative dentistry. I relocated. I had a sleep practice in another general dental practice that worked well for a while, and then other things happened, and then that started to fall apart. And so now I'm down in the Four Corners area of Colorado, so kind of near Durango, near Telluride. I can be in the desert in an hour. I can be in the mountains in 45 minutes. It's kind of the best of both worlds. But that was the tipping point, is I saw it in my own child, and I had seen it in my restorative patients, and I had seen my work failing over, years. And I'm like, I did a really good job. Why is that broken? Yeah. I had never asked that question before. I was a mechanic of teeth, right? I think we all come out of school as mechanics of teeth. We know how to make a crown. We know how to do a filling. We know how to address periodontal disease the best that we can. But in large part, schools aren't teaching much airway or sleep, which in my opinion is root cause to a lot of the problems that we see every day in our clinical environment.
Right.
And it's helping, first you got to take your blinders off so you see it. Like, that's what we see every week when we do a seminar, when we go into a practice and do a seminar. You just start showing them, how do you screen for a patient? So I don't like to disrupt my workflow. You know, that's the kiss of death right there. If you put dental sleep medicine into a practice and all of a sudden you're going down this rabbit hole with snoring and OSA with a patient that came there to get their dental work done. They came to get their teeth cleaned. Like, that's just verbal vomit. They were not in a psychological mindset that day to listen to you, and they probably aren't listening to you. You're just talking. So I think that's what we do well now, is teaching practices how to just go about doing your normal practice, but set up an independent sleep department that is in large part ran by a trained auxiliary. And so in dentistry, you're going to make money three ways. You know, you're going to do it with your own hands. And these are the implant people, right? When the doctor chooses implants, they've just sucked themselves into the case because no one else can do that procedure. I was having some flooring put into my house today, and the guy had marked on the trap door, like where the crawl space was, and he cut it out, and he had marked it like off a little bit. And so, you know, in flooring, you just pull up the flooring pieces, you start over. And I said, I never had that luxury in my job. You know, if we miss the bone, the implant's out the side and the jaw into space and it fails, we say next patient. I guess that's our restart. But like, you can't just undo what you did. And so digital workflow was always big with me. I was a techie. You know, I totally give Gordon Christensen the credit for that. It was, you know, better, faster, cheaper. You know, pick two. You're either going to do better and faster, but it ain't going to be cheap. Or you're going to do faster and cheaper, but it's not going to be your best.
Yeah.
And better and cheap, but that's, you know, whatever is out there. Now, go ahead.
I like the transparency that you shed on having 3 different sleep practices before you got to that point where you sort of dialed it in and you get how you're running your current practice seems to be a successful model. Do you have words of wisdom, feedback, or thoughts about, I mean, maybe it was just circumstantial and those didn't succeed simply because of the circumstances around it, not because of the sleep dentistry themselves or itself, but maybe as you've evolved through time, you've learned how to dial in those processes and systems better to make them more profitable and effective. Maybe it's a combination of both. So I'm curious to hear, you know, the pros and cons and what you've learned through that journey. Because I do know there are lots of doctors out there that envision, and to your point, see a day where they're going to move to be a comprehensive sleep dentist as opposed to doing routine general dentistry. Yet the path and the journey seems very daunting to kind of figure out how you're going to negotiate that.
And that's why we exist as a company. You know, it's a tough road to hoe by yourself. You know, many people try to do it on their own. They'll come to the seminar. We'll basically tell you all the parts of the bicycle, and we'll tell you how to build the bicycle. Then for one reason or another, you get back to your practice and you misunderstood one of the steps, or no one was there to hold your hand. I always like to talk about puzzles. You know, when you're putting a puzzle together, because there's probably at least 6 pieces that are major to this puzzle. And you would think a 6-piece puzzle, that's not very complicated. You know, anyone can do that. But we can all agree that if you had that 500,000 piece puzzle, whatever you want to call it, you know, whatever the big puzzle is to you, does it take longer the first time you do it by yourself? And wouldn't it be faster and more fun to have a friend to do it with who's done the puzzle a bunch of times and you know exactly, you know, kind of where the colors and the shapes and pieces fit together? Like, that to me is the best analogy of what going to a Sleep Group Solutions seminar and then deciding, we call it the family, you know, joining the Sleep Group Solutions family is. If we were to segue that into my new role, which is what, you know, prompted Chad to invite me onto the show, it's, and I'll go back to what I was talking about earlier. You're making 3 monies in dentistry. It's your hands, a hygienist hand, you know, running a well-versed periodontal department in your practice, which was my former life. I'd go in and do consulting and pull perio codes versus profi codes, and you can bet on like one hand you're going to run into about a 12 to 20% perio ratio in most general practices. You know, the lowest I ever saw was 4%. Everything was profis. And if we know the ADA is telling us 80% if you factor in gingivitis, of the population has some level of periodontal disease. Like we should be seeing 40 to 50% or higher. Granted, some patients won't come to the dentist, so we don't see everybody, but the ones that show up probably value oral health, so maybe we can nink it down a little bit. But I looked at that for 15 years, and I'll tell you, on average, it was 12%, maybe 20. So like if anyone wants to do that, pull the metrics out of the software that you use to see how many 1120s, 1110s, like even throw the kids in there, versus all your 4,000 codes, all your perio codes, and just do your calculation, do your ratio. But that was another side trip down the long story of being a dentist, is learning how to run the business, right? That's probably one of our bigger challenges. So you two said you dabble in sleep. So I'm curious, what are the challenges you see? Because like I see them from all over the country. I can probably put them all in about 5 categories, and let me hear yours, Chad, since you haven't gotten to talk much.
I'm glad you asked, because there were a couple things that I wanted to talk about. Maybe dabble wasn't the word. I think that maybe you mentioned Kent Smith earlier, and I think what Kent said was really pretty phenomenal, because with what he said, dabble's probably not the right word. What I'm noticing is my eyes are being opened through people like you, through people like Dr. Horowitz. God forbid I mention this name, but people like Ronnie. I'm teasing.
He's watching, he's
yeah,
watching.
I know he is. That's why I had to say his name, Ronnie. But through Deuce Robertson, let's throw that out there too, because my eyes are being opened to what's going on in our society. And so when I say dabbling, my feet are just starting to get wet and realize how severe the problem is in America. Let's just leave it there, because we know it is worldwide. But
let me ask you a question.
Yeah.
On an average, like you said you're 15, 20 years.
20 plus, yeah, 23.
Okay. And when did the sleep bugs start to nibble at you? How many years ago?
It's been about 3 years now.
So for 3 years, you've kind of been aware of airway. If you had to guess, are you keeping track of metrics? Do you keep track of how many patients you've screened and how many, need further testing?
I haven't, but it's quite a few.
Yeah. I kept those metrics, right? So I had business coaches that taught me how to run the business. From 2007 to 17, we screened 96% of the patient population. 2/3 of them needed further testing to get a diagnosis, because in the practice we can only ask stop bang questions, Epworth sleepiness, all the normal stuff. If you're sleep group, you can take echo vision measurements to see collapsibility of the airway. If you have cone beam, you can take cone beam and find all the small airways and miss the totally big ones. Like I failed cone beam. I bought one of the first cone beams, and it looks beautiful on the software, but I have OSA. I have moderate OSA. But I also lost 72 pounds. And so, it's never one cause. I think that's something that we have to think about, is sleep apnea, when you get into managing these patients, is never about just the oral appliance and never just about losing weight. It's never about, you can't throw it at one thing. When we look at the body poster, see if this will show up on camera or not. There's not a single body system that's not impacted by sleep, because if you go to Matt Walker's book, Why We Sleep, in the beginning, we thought it was to dream. Maybe it was, spiritual, messages were sent to us from somewhere else. Maybe it was creativity. Maybe it was memory storage. Maybe it was just, rest, lie down. But it's really our reset. So it's the closest we can get to hibernation in human form that we do on a daily basis. And if we think the ideal adult percentage of sleep is 8 hours a day, that is 1/3 of your life you're going to be spent sleeping if you only factored as an adult. Now, if JB's had kids, I've got 2 daughters, you've got kids. When they're babies, they'll sleep 18 hours. It's never when you want to sleep, but they sleep a ton. And it's because your brain is going to do what it needs to do. And most of the recent literature is focusing around memory issues and dementias. And so, with my former wife, we had that in the family. And I can guarantee you this was something that started decades earlier, that you pay the price down the road. So it's my charge to ask dentists to be healthcare providers. Play your part of the team.
And it's interesting. I find myself becoming more and more of that. This is a question for both of you all, and it relates to what we're talking about tonight. But I remember years ago on an airplane, I was flying back from Southern California to Fort Worth, and I sat next to these two people. And the guy started to have a conversation with me, and man, I just shut off real quick, because every time he spoke, all I could smell was tartar. I mean, he had the worst perio breath on the face of the earth. And so I'm sitting here thinking, how do I address this with this guy? He's probably 25, 30 years old. How do I address it with him? And finally, at the end of the flight, I was so done. It was a 3.5-hour flight. I was like, dude, you were a really nice guy, but you need to get your freaking teeth cleaned. You need to get into a dentist ASAP. So fast forward, I'm starting to notice more and more snorers on the airplane. So on Sunday, my wife and I are flying home. My wife's a nurse. My wife and I are flying home. And we're in the exit row, and this guy sits on the row in front of us. And I mean, he's huge. He's huge, huge, huge. Sits down. I mean, they haven't even come by to ask the yes, you're in the exit row thing. Are you going to open the door and all that shit? And this guy is out. I mean, he's out, but I mean, he is, just snoring like crazy. And I look at my wife and I'm like, Ellen, watch this guy. Watch this guy. She's like, what? He's snoring. I was like, no, watch him. And he would sit there, and here he is sitting up, snoring up a storm. He's probably maybe 30 years old. And he would stop breathing, and his entire body would reposture. And then he would catch a breath, and then he'd fall asleep again, go through like 4 or 5 snoring cycles, and then he would pop. And I looked at her, I go, he's going to die. And I go, part of it's the weight, but if you got rid of the weight, that would help with the breathing. I said, but this guy's got a major issue. And my wife's like, hitting me. She's like, say something to him. Say something to him. I'm like, shit, I don't know what to say, So,
trying to lose weight when you have OSA is not possible.
Exactly. And
so go into your sleep patterns, and what happens is, there's 2 hormones. There's ghrelin and leptin. So ghrelin is when your stomach growls and it tells you you're hungry. Leptin is when it says, hey, I'm full, like, stop feeding me. But, treating that severe obese OSA patient isn't always the easiest thing either. Like, that's not going to be the first one I choose. I practiced in Colorado Springs. So we have the Olympic Training Center. Then I went to Steamboat Springs. They produce more Olympians than anybody in the U.S. But even the fittest athletes, the elite of the elite, have sleep-related breathing disorders. Mm-hmm. And it can be, like, we're seeing it tick down. I was just in Ohio last week, and they were talking about teens and polycystic ovarian syndrome, menstrual disruption of cycles, irregular. It ties back to breathing, and it ties back to sleep. And so, like we were talking earlier, there is just not a body system that is exempt from air. Yeah. Like, our first 2 medicines are the air we breathe, because we breathe before we eat when we're born. The second one's how we feed when we're newborn, and how we transition from breastfed into hard foods. And so if we're going to cycle back into the root cause here, it's, we're basically the Gerber generation, and we're paying the price of soft foods. Same nutrients, but there's no chewing. Chewing is the functional matrix for the jaws to grow. The teeth just kind of are along for the ride. Orthodontics has it backwards right now. They're straightening teeth when they should be making a foundation, because you can't build your house and put the walls inside the foundation. It just all collapses. So retention for life should be like the big red flags, waving in our face. And Kevin Boyd, who's a pediatric dentist in Chicago, he will be the first to say, if there's anyone that's going to save us in the next generation, it's going to be general dentists that are willing to treat children and willing to do orthodontics. And so I'll draw the triangle on the board. You may have met me for one of 3 reasons. Sleep, probably. TMD, or ortho, but they're all three connected.
So I think this is really fascinating, and I mean, as we're coming to a close here, I want to put a charge out to you because I love what you said, and I think this is the perfect spot to maybe pursue another interview. I really would love to focus, and it may not just be one interview, it may be a couple, because and I said earlier dabbled, but as I've learned
How many
more,
devices do you do a month? So I never finished my question, which is typical.
oh God, I don't
3
even
years,
know. I mean, maybe one a month, but
one a month. But you
yeah.
see how many patients a day?
Yeah, but here's what's happening. Let's back up just a little bit.
This is
So
what my
I'm
ninth
also
grade
very
geometry teacher said, yeah, but.
yeah, but okay, so let me tell you this. I refer a lot to the ENT, and I have them evaluated for sleep related disorders. They end up in a CPAP. If there's intolerance to the CPAP, then somehow they end up in some other clinic to get a sleep device.
That was
They
my
do
avenue for
sometimes get
years until I heard a sleep physician in April say the opposite. He flipped it. He was like, I would rather have the patients coming to me already failing in oral appliances because I can take it off the table. I'm like, oh, you just gave me the green light. I can make, and he's like, with COVID right now and the delay to get an appointment, and with sleep centers for a long time being shut down, like they were shut down longer than our dental practice.
Yep.
So home testing is essential. That's one of our components. You know, having a friend is a component, having technology that tells you what's the potential outcome that you're going to get. You know, that's what we teach at the seminar. That's what we'll bring to your office if you want to learn it. I actually did this a couple months ago. I went into a practice and just worked for a day. And I found half of their patients were OSA patients. And so the fact you're doing one a month, like I kept the data for 10 years. It was 2/3 needed more testing. Of the 2/3 that needed more testing, half actually got it done. Of the half that got it done, every stinking one of them had a problem. Half of those ended up with the CPAP, the other half was probably split between oral appliance, and they just didn't care to do anything. But it takes 12 to 13 years off your life. So you're either going to have a good exit, or you're going to have a vibrant, like think of the old person who's vibrant and can do anything they want. And then look at the person you went to high school with, and you're in your 30s, 40s, 50s, and they just look like, you know, a totally different person. It's crazy.
No, and you know, I totally get all of that. And the other thing that's really driving me nuts right now is seeing young children that aren't thriving, that have constricted palates, and you know, like finding an orthodontist in our area that actually understands this. And
Good luck.
so
Yeah.
that's what I really,
I challenge you, Chad.
Yeah.
I got some connections. I challenge you.
that's what I want to see. And you know, I'm getting ready to go spend a weekend. We're going on a golfing trip this weekend with the orthodontist that I work with here, one of the orthodontists, and he and I are going to go play golf. And we've talked time and time again about really pursuing this sleep thing, because we're both noticing issues, and we want to work in conjunction with one another. And
yeah.
I mean, I challenge everybody to.
It's funny you say that, because that was another one of my whys that I didn't disclose. Was I was working, I was doing tethered oral tissues releases, so tongue ties, frenum. You know, that was my laser roots. And I thought, just treating that, because like by training, I'm a surgeon, right? I'm a DDS. I went to a hospital-based GPR basically because I wanted to be a trauma oral surgeon. And you know, for a long time, I thought releasing the tongue was going to be it. And actually, myofunctional therapy, which is like my newest, you know, enlightenment, if I had done that years earlier, it would have been so much better. But I didn't. Like, we only know what we know, and we don't know what we don't know until we learn it. So the challenge is, be a lifelong learner. Put your patient first, because everything else falls into place, and make sound business decisions. And if it means partnering with somebody that can hold your hand through the whole process and take you into the next realm of, you know, making you a part of a larger group, big picture, where we get discounts and we've got in-network benefits, and we've got, a proven system. People that have made this their exclusive business and have transitioned away from the grind of the day. That's what my mission is now in my new role. So.
Well, Jeff, I can't thank you enough for your time. I mean, it's been so enlightening. My best friend from dental school practiced obviously pretty close to you in Colorado Springs. Did you remember Johnson and Johnson?
Yeah.
Brandon and David Johnson?
Sure.
Well, Brandon and I were best friends in dental school. So anyhow, I just I love that area, so I'm a little jealous and envious of that. But I love what you've done. I love the approach you've taken to dentistry. I always say this, that do we want to be tooth mechanics, or do we want to be physicians of the oral cavity? And I think that the latter is what we should strive to be. And I think that I say that, but I noticed that I need to do better at that myself. So let's have you back on again. Let's get an orthodontist on here, and then maybe
I've got one. I've got several we could get on.
That'd be great.
I think he did this intentionally, so there wasn't two Jeffs.
Yeah. Well, Jeff's going to come on. We'll let him talk TMJ because he supposedly knows a little bit about that. But anyhow, thank you so much, and let's have you back on again.
Love to do it. My pleasure. Thanks for the invite.
Thanks, Jeff.
Thanks, Jeff. Good to see you.
Good night.
You too. JB, what an awesome guest.
You didn't put your cowboy hat back on when he came up.
There we go.
Nice. Mm-hmm. So you got any lectures or anything coming up soon?
Yeah, actually, shoot, that just dropped. That wasn't good. We're good. Nothing's broken. Okay. I am speaking next weekend at the Glidewell Symposium. So, and then what's after that? Then I've got a month off. It's like so exciting. I got a month off, and then Jeff and I will be in Nashville speaking lasers and CBCT. And then I've got, just a couple webinars here and there, but Chicago Midwinter, we're all going to be at Chicago Midwinter. Right?
Are we?
So.
Yes. Yeah. I will be there.
What about you? What kind of lectures you got going on?
Coming up next, I'm doing the Formlabs User Summit is coming up, and I'm doing a kind of town hall talking about the printing of permanent restoration. So I'm actually really excited because much like you and dabbling in sleep, I'm dabbling in the 3D printing world. I do a couple things really, really well, and a lot of things I'm really scared of. And permanent restorations is definitely one of those things that I've kind of been apprehensive. So I get to interview two of their top clinicians in permanent restorations, and just kind of like what we do every night, just sit there and take it all in. So be a student and an interviewer at the same time. So I'm pretty excited about that. That's coming up. Their user summit is at the end of the month. So
that is awesome. Are you going to see my buddy Giorgio Haddad?
I am going to see Giorgio.
Tell Giorgio, and then
yes, I will. And then I currently serve on the Align board, and we're meeting this weekend. Awesome. So if you have any feedback of things you'd like to see from Align, I'm your conduit to get that information out. So don't hesitate.
Well, while you're at Align, I will be competing, my senior qualifying tournament in Arkansas.
Oh, is that this weekend?
Yeah.
Amongst
it's not
other
a senior qualifying tournament. I'm playing with I'm playing golf with we talked about this guy a lot. I can't wait to tell him the stories we told, but I am playing golf with the Dr. Jose Chow this weekend.
Are you really?
In Arkansas. Yeah, 2 other buddies. Yeah, it's going to be a really good time. So 2 dinks in Arkansas. What could possibly go wrong?
Oh, sounds totally safe.
Yeah. So I guess I'll close this out. We're a couple minutes late, but I do want to say this. As always, I love what we do. I know we both do, but one of the most rewarding things that we can get as a compliment afterwards. And I'm not begging for compliments, but as we were closing out tonight, I got an awesome email from a very good friend that said, "Hey, I love what Jeff is doing. How can I find out more about what Jeff is doing?" And started talking about his sleep practice that he's building. And to me,
Yeah.
that means that what we're doing might be working. So, with that being said, our goal at Dentists in the Know is to bring you into the know, to make you a more well rounded clinician, to give you a little bit of inside knowledge into the wonderful world of dentistry between clinicians, manufacturers, team members, and so on and so forth. And we just thank each and every one of you for watching every week. And until next week, why don't you stay in the know? Have a great week.
Night.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.